17th 21st Century Cures presents the science behind PhytoMed honey.
Over the past 12 years, I have been practicing honeybee zoopharmacognosy, using all of my skills in ethnobotany, chemistry, and ecology. The bees have led me to the 17th century Negro materia medica, which we are modernizing to develop 21st century cures. Bees are like pharmacists. They biomagnify chemicals in the nectar of the plants, which they store in concentrated form in honey. So there is a relationship between the botany of an area and the properties of the honey produced in that region. I have been able to develop a proprietary planting scheme of medicinal plants, and together with our proprietary honey production techniques, we are able to repeatedly produce an award-winning medicinal honey. PhytoMed honey. Been sharing our story for the last 2 years. We've been doing intense research. I've got a team of scientists all over the world who are working with me. We had a scientific panel of Apimondia, that's the World Commission on Beekeeping, review our work and accepted it to be presented at the last Apimondia, which was in Montreal, where Dr. Pradhan and I shared the science of our work. So COVID-19 happened, but we were already doing quite a lot of work. One of the first things that we did was to share our PhytoMed honey with the frontline medical team here in Grenada. COVID happened and we learned about the trials through the US government site and contacted the lead investigator, Dr. Ashraf, who at the time was in Pakistan. We shipped our honey out to Pakistan and they started using it on their patients. The results from using our honey was phenomenal. COVID positive patients recovered within 72 hours and their second PCR test was negative. We saw the results with many patients using different strengths of our PhytoMed honey. We even used our PhytoMed honey here in Grenada with COVID-19 patient 25 and 26, and they were PCR negative after 4 days of treatment. So you're probably wondering why our honey is different. We have done quite a lot of work analyzing the chemicals in the honey. Honey is made up of about 80% sugars, but the rest is chemicals that are from the plants that is concentrated and preserved in this sugar, which has a very low moisture content. And from the analysis, we found over 176 phytochemicals. Over 35 of those phytochemicals are antiviral. And we were able to track those phytochemicals back to our proprietary planting scheme of native medicinal plants. We found that many chemicals in the honey had very high binding affinity with the proteins in the virus, thereby preventing the replication of the virus and removing viral load, in fact, just stopping the action of the virus. One of the proteins that everybody is trying to develop cures for is HER7ALH. It's the main protease that is key for replication of the virus in the body. And many of the chemicals are able to dock with the receptor sites on the protein and thereby making it unavailable to do its replication. We've compared our honeys to other honeys, and we found that the concentration of the phytochemicals in our honey is much higher, and some of these chemicals are not present in many honeys that are available on the market. So that's why PhytoMed honey is unique. We've looked at the bactericidal and bacteriostatic activity against Klebsiella pneumoniae. Klebsiella pneumoniae is quite involved in some of the co-infection we see in COVID-19 patients, resulting with the problems in pneumonia, etc. And the bactericidal kinetics show that the phytochemicals in the honey are able to kill the virus and in some cases stop the replication of the bacteria. The phytochemicals are also anti-inflammatory and antioxidant, and that's very important for managing the symptoms and for repair and healing.